So why should people care which title their surgeon uses?
Because that speaks to experience and training and one's ability to deal with everything that's thrown at one. If you're going to call yourself a cosmetic surgeon, you're not a fully trained plastic surgeon.
What sorts of questions should they be asking?
I would start by asking them whether they're a fully qualified plastic and reconstructive surgeon. And if they're not, you're wanting something that is a more generalized procedure, then you probably shouldn't be talking to that person.
When it comes to choosing a surgeon,
Find someone who's fully trained.
Kia ora, and welcome back to the Cutting Edge Plastic Surgery podcast series. Today I'm joined again by Dr. Adam Greenbaum, plastic and aesthetic surgeon. So today we're tackling a topic that confuses a lot of people, the difference between plastic, aesthetic and cosmetic surgery. So whilst these terms sound quite similar, they're actually quite different, and it's important for you to understand what that difference is. And it's those things that we're going to be tackling in our podcast today.
Well, and this really goes to the heart of the issues. I suppose to understand the term plastic surgery first and what a plastic surgeon is. The word plastic comes from the Greek plastikos, which is malleable or to change form. And indeed, there was plastic surgery going on long before the term became synonymous with the material that we use in lunchboxes and everywhere else. It is the surgery that's done by specialists who've had a broad training across the body in fundamental techniques, which we use to reproduce function and form after people have had illnesses, trauma, cancer. We're putting back as far as we can what was there beforehand.
Let's start there. What exactly does a plastic surgeon do?
Plastic surgeons are involved in reconstruction, either of form or of appearance, occasionally in rejuvenation of previous appearance, and we'll come on to that. But in terms of reconstruction, when there's been a calamity, when one's had a burn, when one's had an amputation of a digit or a limb, when there's been a large reconstruction and removal of tissue after cancer, we're called in either after the fact or during a procedure done by other surgeons. So we interact with almost every other form of surgeon. We, in essence, we analyze what's missing, analyze what's available to us, and as best we can, reconstruct form and function.
So what's the difference between cosmetic and aesthetic surgery?
Broadly speaking, there's one difference, and that's if you're calling yourself an aesthetic surgeon, you will have come from a background in plastic surgery, plastic and reconstructive surgery, and been trained that way. And if you're going to call yourself a cosmetic surgeon, then you're not. You come from another surgical specialty maybe, but not a fully trained plastic surgeon.
So why should people care which title their surgeon uses?
Because that speaks to experience and training and one's ability to deal with everything that's thrown at one. So a fully trained plastic and reconstructive surgeon will have done at least a decade of training, usually have multiple fellowships, and a full training across the board in applying fundamental techniques of plastic and reconstructive surgery, understanding what complications can occur and dealing with those complications. There are subgroups. So, for example, you will find a group of general surgeons who've had extra training who would call themselves oncoplastic surgeons, and they're fully qualified to do what they do, and that's breast reconstruction. You will find a group of ear, nose and throat surgeons who will also term themselves facial plastic surgeons, and a group of ophthalmologists who will call themselves oculoplastic surgeons. And they are perfectly reasonably also, therefore, going to deal with aesthetic surgery in their small subspecialty, but only plastic surgeons have been fully trained and qualified to operate in aesthetic rejuvenation across the board around the body.
If someone's thinking about surgery, what sorts of questions should they be asking their surgeon?
Well, again, that's another fundamental question. I would start by asking them whether they're a fully qualified plastic and reconstructive surgeon. And if they're not, and you're wanting something that is a more generalized procedure, then you probably shouldn't be talking to that person. Then you would want to go on and ask them how often they do this procedure, whether they do this procedure in the public system as well as in the private system. Now, there are some aesthetic cosmetic procedures that would not be done in the public system. Generally speaking, there are versions of something that would be done for reconstructive surgery that you would see being done. You'd want to know how many times they've done this in the past. You'd want to know what their complication rate is. You want to know if one has a complication, how they would sort this out, how many times they've done it. You'd want to be able to see some preoperative and some postoperative photographs of patients they've treated in the past. And if they can't show you those, you'd want to know why. It may be that patients wouldn't want to be recognised in a place like New Zealand where everyone knows everyone. That's quite a reasonable reason. But you would want to delve deeper if they've can't show you any pictures of what they've done and how that's turned out. That might be a red flag, because everyone has complications. A great many of the complications that patients have after surgery has really got nothing to do with surgical technique. It's got to do with bad luck, whether you have an infection, whether you have a bruise. Now, there are many things that skillful surgeons can do to mitigate those risks. But inevitably, a proportion of every surgeon's patients will have a complication. What you want is someone who's going to be there to hold your hand through those complications, because they're experienced, they've been trained, and they are empathetic, and they know that this is going to happen, and they know what to do when it happens, so that can mitigate the problems that will stem from complications. But everyone has complications.
That's really helpful advice. So what sort of approach do you take at cutting-edge plastic surgery?
Well, I suppose, as I was saying before, surgeons should be willing to take all questions, and I welcome that right from the start. So, complete transparency, I produce an interactive information sheet for all aesthetic procedures, and I would have sent that to any patient who's coming to see me first and asked them to read through that. So they already come to me with all the information that I think someone who's approaching a particular procedure needs to know. And then we will go through that in some detail. They'll have a full general examination. So, if someone comes to me for breast surgery, they're still going to have a full examination and a full general examination of their breasts before we start talking about aesthetic considerations. We book out an hour for these procedures, and patients pay a fee for that. But if we're going to overrun, that's fine. We will stop at an hour, because I'll have someone waiting to see me, and I don't want to make them wait unduly. But patients can then return free of charge as many times as it takes for us to work through everything. And that's sometimes quite a good thing, because we'll book that a week or two later. It gives them a chance to think about what we've discussed. If they have any other questions, I encourage them to write them down. All of this happens on the interactive information sheet, which forms a record of our consultation. I'll have a copy of that. The patient will have a copy of that. My record is 6 or 7 consultations. Other than the first one, those were all free of charge. And it means by the time the patient's having surgery, they absolutely understand everything that's going to happen. They understand the likely outcomes, the realistic goals. I've been able to work out whether my skill set can give them what they want, and whether those are realistic aspirations.
So to sum up, plastic, aesthetic, cosmetic are very similar terms, but they mean very different things.
Well, that's exactly the thing. There are 3 different terms, and they're somewhat interchangeable. Plastic surgery is using fundamental techniques for reconstruction and doing so in an aesthetic way with aesthetic sensibilities. But aesthetic and cosmetic surgery, whilst they could be seen to be interchangeable, it's important to understand that they're dealing with the same thing, but they should always be done on the basis of a rigorous training and application of safety and good clinical standards.
So when it comes to choosing a surgeon, do your research, check their credentials, make sure you're really comfortable before you do anything?
Absolutely. Find someone who's fully trained.
Thank you, Dr. Adam Greenbaum.
My pleasure.
And thank you for tuning in to Plastic, Aesthetic, Cosmetic, What's in a Name. If you'd like to learn more or book a consultation, head to Cutting Edge Plastic Surgery at ceps.nz and find out more. Stay safe, stay informed, and make choices you feel comfortable with.